Good day. Today we will talk about the amazing, almost magical connection between dogs and people suffering from depression. Each of us has heard the expression a dog is man's best friend at least once, but few think about how deep the meaning behind these simple words is, especially when it comes to mental health and fighting one of the most common disorders of our time, depression. Depression is not just a bad mood, momentary sadness, or temporary blues. It is a serious condition that completely changes a person's perception of the world, painting it in gray and black tones. Imagine, every morning you wake up feeling as if a heavy stone is lying on your chest, preventing you from breathing fully. The smallest everyday tasks, from brushing your teeth to preparing breakfast, and seem like insurmountable obstacles. Things that used to bring joy now evoke no emotions. This is the reality in which millions of people around the world live, fighting every day not only with external circumstances but also with their own minds. But there are amazing creatures capable of penetrating through this gray veil, our four-legged friends, dogs. Scientists from Oxford University conducted a study that showed that people who have dogs have a 25% reduced risk of developing depression compared to those who don't have pets. You'll agree, this is impressive statistics. But behind the dry numbers lie real mechanisms of influence that make dogs true therapists on four paws. Let's start with the fact that dogs have a phenomenal ability to sense a person's emotional state. They perceive the world primarily through smell, and their sense of smell is so sensitive that it captures the slightest changes in a person's hormonal background. When you are tense, sad, or anxious, your body releases certain chemicals that a dog can distinguish by smell. Moreover, dogs are able to read a person's facial expression, posture, and tone of voice, and even micro-movements that the person often does not realize. This amazing set of abilities makes dogs incredibly sensitive to their owner's emotional state. Japanese researchers from the University of Tokyo found that when a dog looks into its owner's eyes, the level of oxytocin, the hormone responsible for forming attachment and trust, increases in both organisms. This process is very similar to what happens between a mother and child. Think about it. Evolution has endowed dogs with the ability to establish the same deep emotional connections with us that exist between the closest people. Amazing, isn't it? Let's look in more detail at exactly how dogs help people with depression. First of all, they create a stable daily routine. For a person suffering from depression, maintaining a schedule can be an overwhelming task. Days merge into one endless stream of gray, joyless existence. It may seem surprising, but a dog solves this problem naturally. A pet requires attention, needs to be fed at a certain time, walked on schedule, played with, and all this becomes the reference points that structure a person's day. Imagine, 7 in the morning, you are still sleeping, wrapped in a blanket, fenced off from the world. But then your four-legged friend jumps on the bed, wagging its tail and reminding you that it's time for a morning walk. You could, of course, wave it off, but a wet nose persistently pokes into your face, and devoted eyes say, "Come on, I know you can." And now you are already getting up, getting dressed, taking the leash, feeling a small sense of responsibility and satisfaction growing inside. You are needed by someone. You are doing something important. This is the first step to regaining control over your life. A study conducted at the University of California showed that even simple planning of feeding a dog can be an important therapeutic factor. Patients with depression who regularly fed their pets noted that this activity gave them a sense of structure and order that is so lacking in emotional disorders. Now, imagine an early morning, the sun is just rising, dew glistens on the grass, and you are walking through the park with your four-legged friend. Fresh air fills your lungs, nature around is slowly awakening, birds begin their morning concert. In such moments, even a person with severe depression often feels a fleeting sense of unity with the world, a brief glimpse of joy. These regular walks are not just a pleasant pastime, they are real therapy. Physical activity, which inevitably accompanies having a dog, has a scientifically proven antidepressant effect. When moving, endorphins, natural painkillers and antidepressants, are produced in the body. A study published in the journal Mental Health and Physical Activity showed that even 30 minutes of moderate physical activity 3 times a week can reduce depression symptoms by 40%. And dog owners spend an average of at least an hour a day on active walks, which significantly exceeds the recommended minimum. But it's not just about physical activity. The very process of communicating with a dog triggers a whole cascade of positive biochemical reactions in the human body. When you pet a dog, your brain begins to produce serotonin, a neurotransmitter responsible for feelings of happiness and satisfaction. It is its deficiency that is associated with the development of depression. In parallel, the level of cortisol, the stress hormone, which in excess negatively affects all body systems, decreases. It turns out that simple stroking of a dog replaces a whole cocktail of antidepressants and tranquilizers, and without side effects. Swedish scientists from the Karolinska Institute conducted an experiment in which they measured hormone levels in people before and after 15 minutes of communication with dogs. The results are impressive. The level of oxytocin, attachment hormone, increased by 57%, the level of beta endorphins, natural painkillers, by 51%, and the level of dopamine, pleasure hormone, by 44%. At the same time, the concentration of cortisol decreased by 25%. These changes are comparable to the effect of many medications, but they occur faster and have no negative consequences. One of the most painful aspects of depression is social isolation. A person moves away from friends and loved ones, withdraws into themselves, loses communication skills. Getting out of this vicious circle can be long and painful, but dogs significantly facilitate this process, acting as social catalysts. Have you noticed how often strangers start talking to you if there is a dog next to you, especially if it's a puppy or a rare breed? What a beautiful dog. Can I pet it? How old is it? What's its name? These simple questions become the beginning of a conversation that can grow into a pleasant acquaintance. A Harvard University study showed that dog owners are 30% more likely to engage in social interactions during walks than people without dogs. For a person with depression who finds it difficult to initiate communication on their own, a dog becomes a kind of bridge to the social world. Gradually, a circle of acquaintances on dog interest is formed. New connections arise, the social network expands. A person realizes that they are not alone in their problems, that there are people around ready for communication, without judgment and pressure. There are even special support groups bringing together dog owners suffering from depression and anxiety disorders. In such communities, people not only exchange experience in pet care, but also find emotional support, understanding, and sometimes professional help. Interestingly, these groups often conduct joint walks and training with dogs, which further enhances the therapeutic effect. Special attention should be paid to the role of dogs as teachers of mindfulness and living in the present moment. Meditation and mindfulness practices are considered effective methods of fighting depression, but mastering them can be difficult. Dogs naturally demonstrate how to live here and now. They don't worry about the past, don't worry about the future. Every moment for them is filled with meaning and interest. Observing such an attitude to life gradually changes a person's perception as well. Imagine you are walking through the park, immersed in heavy thoughts about past mistakes or future problems. But your dog notices a butterfly flying by and with sincere delight rushes after it. This moment of pure joy involuntarily attracts your attention, pulls you out of the whirlpool of negative thoughts. For a brief moment, you are also in the present, noticing the beauty of nature, feeling the warmth of the sun on your skin. Such moments of awareness gradually accumulate, creating a counterweight to depressive thoughts. Psychologists from Stanford University conducted an experiment in which patients with depression were asked to observe their dogs daily and record what exactly attracted the pet's attention. After 8 weeks, 83% of participants showed significantly improved scores on depression and anxiety scales. Researchers associate this with the development of attentiveness skills and shifting focus from internal problems to the external world. The topic of unconditional love and acceptance that dogs give us deserves special discussion. In a world where people constantly evaluate each other on many parameters, appearance, status, success, financial position, dogs remain amazingly unbiased. They don't care how you look, how much you earn, what position you hold. They love you simply for being there. For a person with depression who often suffers from low self-esteem, feelings of guilt and worthlessness, such unconditional acceptance can be a real revelation. When a dog meets you at the door, jumping with joy and wagging its tail as if you're the most important person in the universe, this is a moment of pure, unclouded love. Such moments gradually change a person's self-perception, help them see themselves through the eyes of a dog, worthy of love and care. Researchers from the University of Missouri found that the level of oxytocin in people interacting with their dogs is comparable to the level of this hormone in young parents hugging their children. Such powerful biochemical reactions form a sense of emotional security and acceptance, critically important for restoring mental health. In medical practice, specially trained therapy dogs and emotional support dogs are becoming increasingly common. These four-legged healers undergo special training to work with people suffering from various mental disorders, including depression. What is special about such dogs? Therapy dogs are trained to recognize signs of an impending panic attack or exacerbation of depression even before they become obvious to the person themselves. They can notice changes in breathing, heart rate, body odor, or micro movements that signal a starting attack. At such moments, the dog begins to act. It can press against the person, creating the effect of a weighted blanket, which calms the nervous system, distract them with play or barking, and in some cases even bring medicine or a phone to call for help. At the Mayo Clinic, a study was conducted involving patients with severe depression resistant to medication. After 6 months of working with therapy dogs, 68% of patients showed significant improvement, and 32% were able to reduce the dosage of antidepressants under medical supervision. These results have caused many specialists to reconsider the role of animals in the therapy of mental disorders. There are truly amazing cases where dogs literally saved their owners' lives. In moments of deepest depression, when a person loses the will to live and considers the possibility of self-harm, the thought of a pet that will be left without care and love can be a decisive factor. Who will take care of my dog if I'm gone? This simple question often becomes the anchor that keeps a person on the edge of the abyss. A study conducted by the American Association of Suicidology showed that among people with suicidal thoughts, those who had pets, in 62% of cases, named caring for a pet as one of the reasons why they did not act on their intentions. For many, this became the interim period when they were able to get the necessary professional help. It's interesting to note that different dog breeds can have different therapeutic effects. For example, active, energetic breeds, such as Labradors, Border Collies, or Jack Russell Terriers, can be especially helpful for people with a slowed-down form of depression when apathy, fatigue, and lack of interest in life prevail. Such dogs literally pull a person out of a state of passivity, requiring activity and attention. On the other hand, calm, balanced breeds, for example, Cavalier King Charles Spaniels, Basset Hounds, or Greater Swiss Mountain Dogs, can be ideal companions for people with an anxious form of depression when anxiety, irritability, and sleep disorders come to the fore. Such dogs create an atmosphere of tranquility. Their measured pace of life helps reduce internal tension. Scientists from the University of Pennsylvania conducted a study comparing the effectiveness of different dog breeds in therapy for various forms of depression. They found that Golden Retrievers have the most universal therapeutic effect. These dogs are active enough to stimulate a person to move, but at the same time have a calm, balanced character, which makes them suitable companions for people with different manifestations of depression. It is important to emphasize that a dog is not a replacement for professional medical help for depression. It is an additional, albeit very effective, therapeutic tool that works in combination with traditional treatment methods, psychotherapy, and in some cases, medication support. A comprehensive approach, including both traditional and alternative methods, usually gives the best results. The World Health Organization, in its report on mental health from 2023, for the first time officially recognized the therapeutic role of animals in the treatment of depression, and recommended including interaction with animals in comprehensive rehabilitation programs for patients with mental disorders. This recognition at the highest medical level indicates that the role of dogs in maintaining people's mental health is receiving more and more scientific confirmation. Scientific research shows impressive results. Regular interaction with dogs reduces anxiety levels by 37%, improves sleep quality by 42%, increases self-esteem by 29%, and reduces the risk of depression relapse by 33%. These figures speak for themselves. In some countries, canine therapy, treatment with the help of dogs, has already become an officially recognized method in the complex therapy of depression and other mental disorders. For example, in Germany, many insurance companies include canine therapy sessions in medical insurance programs, and in Scandinavian countries, there are specialized centers where people with depression can regularly interact with therapy dogs. However, to get the maximum benefit from communication with a dog, it is important to choose the right pet. Caring for an animal requires strength and resources that a person in depression may lack. Before getting a dog, it is worth carefully assessing your capabilities and choosing a pet that suits you, in temperament, size, activity level. Specialists recommend that people suffering from depression start with less demanding breeds or already adult, well-socialized dogs. Puppies, for all their charm, require a lot of attention and energy, which can be an overwhelming task. You should also consider the size of your home, the availability of time for long walks, and financial capabilities to provide the pet with quality food and medical care. A good alternative for those who are not ready to get a dog yet can be volunteering in animal shelters. Many shelters invite volunteers to walk dogs, play with them, and help with socialization. Such regular contacts with animals provide many of the benefits described above, but do not require constant responsibility and significant costs. In addition to direct impact on mental state, dogs help people with depression indirectly through the development of important skills and qualities. They teach care for someone other than yourself, which is especially valuable when a person is fixated on their own problems and suffering. Caring for a dog develops empathy, the ability to notice and satisfy the needs of another being, which gradually extends to relationships with people. An interesting study conducted at the University of Toronto showed that dog owners on average are 27% better at recognizing emotions by facial expression than people who have no experience communicating with animals. This is explained by the fact that dog owners constantly train in reading the nonverbal signals of their pets, and these skills are transferred to communication with people. Regular care for a dog also gives a sense of competence and success, qualities that are so lacking in depression. When a person sees that they are coping with the responsibility for another living being, that the dog is healthy, well-groomed, and happy thanks to their efforts, this significantly increases self-esteem and self-belief. I can take care of another being, which means I'm not as worthless as I thought. Such thoughts gradually displace negative attitudes characteristic of depression. In the modern world, where digital technologies increasingly replace live communication and virtual connections become more important than real ones, dogs perform another important function. They return us to the basics of human needs, in physical contact, in attachment, in communication without words and masks. Psychologists from the British Mental Health Association note that one of the causes of the growth of depression in developed countries is a deficit of tactile contact and true attachment. In a culture where touch between adults is often limited and formalized, hugging a dog can become the source of tactile comfort that is critically important for emotional well-being. There is an interesting phenomenon associated with dogs and depression, the witness effect. For a person suffering from depression, the whole world may seem indifferent, cold, even hostile. But the presence of a dog that sincerely rejoices in every moment of life, every little thing, a ray of sunshine falling on the floor, a found stick, a friend met, serves as a constant reminder that the world can be kind and full of joy. The dog becomes a witness to the beauty of the world, reminding its owner of this every day. Writer and researcher Jeffrey Moussaieff-Masson, in his book Dogs and Depression: Unexpected Healers, cites many cases where this witness effect became a turning point in the treatment of severe depression. My dog sees the world as so bright and interesting. Maybe it really is. This thought became the first step to changing the perception of reality. We cannot fail to mention how dogs teach us forgiveness and new beginnings. Even if you were irritated, forgot to feed or walk your pet on time, the dog will not hold a grudge for long. Unlike people, dogs do not hold grudges, do not remember past offenses. Every day for them is an opportunity to rejoice in life anew. Such an attitude can be an example for a person stuck in negative thoughts and memories. Dr. Karen Wallen, a psychiatrist and researcher from Cambridge University, notes, "Dogs are the only creatures on the planet that love you more than themselves." This phenomenon of unconditional love creates a unique therapeutic environment that cannot be reproduced by any other methods. Interestingly, the effectiveness of dog therapy depends not only on the breed of the dog or its character, but also on the depth of the connection between the human and the animal. Research shows that the greatest therapeutic effect is observed in pairs where a deep emotional connection has been established. This explains why sometimes an ordinary mongrel picked up from the street can have a more powerful therapeutic effect than a specially trained therapy dog. It is also important to note cultural differences in the perception of dogs and their role in human life. In some cultures, for example, in North America and Western Europe, dogs are traditionally viewed as family members, which enhances their therapeutic potential. In other cultures, such perception may be less common, which affects the effectiveness of canine therapy. However, research shows that the basic mechanisms of human-dog interaction, biochemical, psychological, social, work in any cultural context, albeit with different intensities. This speaks to the universality of dog therapy as a method of fighting depression. With the development of technology, new forms of using dogs in the therapy of mental disorders are also emerging. For example, in Japan, robot dogs are being developed that imitate the behavior of real animals and can be used in situations where the presence of a real dog is impossible. In hospitals with a special regime, in nursing homes for people with allergies, research shows that even such interaction provides a certain therapeutic effect, although not comparable to contact with a living being. In some psychiatric clinics, innovative programs of dog holidays for patients with depression are being implemented. Within the framework of such programs, patients take a dog from a shelter for several days, completely responsible for its well-being under the supervision of specialists. The results of such experiments exceeded expectations. 87% of participants showed significant improvement, and many subsequently decided to take a dog for permanent residence. Doctors and psychologists increasingly recommend communication with dogs as part of complex therapy, not only for depression, but also for post-traumatic stress disorder, chronic fatigue syndrome, autism spectrum disorders, and other conditions. For example, programs for the rehabilitation of veterans with combat PTSD involving dogs show impressive effectiveness, reduction of nightmares, flashbacks, anxiety, improvement of sleep, and overall quality of life. Of particular interest is the use of dogs in working with children and adolescents suffering from depression. At this age, depression often manifests through irritability, aggression, social isolation, which makes diagnosis and treatment difficult. Dogs become the bridge through which a child can gradually restore contact with the world. In pediatric, psychiatric departments where canine therapy is practiced, there is a reduction in treatment time by 20 to 30%. Children who regularly communicate with dogs more quickly make contact with psychologists, more openly talk about their problems, and better follow the medication regimen. Elderly people are another group for whom communication with dogs has special significance in the context of fighting depression. In older age, depression is often associated with the loss of social connections, feelings of uselessness, fear of loneliness, and death. A dog for an elderly person is not just a companion, it is a source of meaning and joy, a reason to get up in the morning and live each day fully. Studies in nursing homes show that regular communication with dogs reduces the level of depression among residents by 44%, improves appetite, normalizes blood pressure, and heart rhythm. Many institutions for the elderly now open doors for four-legged therapists, recognizing their irreplaceable role in maintaining the mental and physical health of residents. A special topic is the role of service dogs in the lives of people with disabilities suffering from depression. When physical limitations are imposed on psychological problems, this creates a vicious circle that is extremely difficult to get out of. Service dogs trained to help people with various forms of disability not only make their daily lives easier, but also become a powerful antidepressant. The story of Maria, a woman with a progressive form of multiple sclerosis who struggled with severe depression, is a vivid example of such influence. After the appearance in her life of a service dog named Luna, specially trained to help people with limited mobility, Maria was not only able to return to a relatively active life, but also overcame depression. Luna gave me what neither medication nor therapy could give: confidence in tomorrow and joy from every day lived, she says. It is also worth noting the economic aspect of dog therapy in the context of treating depression. According to the World Health Organization, depression is the main cause of disability in the world and one of the main factors of the global economic burden of disease. The cost of treating depression and related conditions amounts to trillions of dollars annually. In this context, dogs can become not only an effective therapeutic tool, but also a way to reduce economic costs in the fight against depression. A study conducted by health economists from the London School of Economics showed that including therapy dogs in depression treatment programs reduces the overall cost of patient care by 23% due to shorter hospitalization periods, reduced medication dosages, and lower frequency of relapses. In the modern world, where the pace of life is constantly accelerating and stress levels are rising, the role of dogs as therapists and emotional partners is becoming increasingly significant. They remind us of the simple joys of life, the value of the moment, the importance of sincere emotions and unconditional love. In their presence, we become more humane, more open, more capable of healing. Dr. Alice Montgomery, head of the research group Dogs and Mental Health at the Harvard Medical Center, notes, "In our research, we constantly observe the same phenomenon. People suffering from depression, in the presence of dogs, begin to smile, their facial expressions become more lively, their voice more emotional. These changes occur at an unconscious level, but they are the ones that trigger a cascade of positive shifts in the psyche." Also interesting is the phenomenon that psychologists call the mirror effect. Dogs are very sensitive to a person's emotional state, but at the same time often mirror not the current mood, but what a person can be in their best moments. By their behavior, they seem to remind, "I know you feel bad now, but I remember you happy and confident, and I know you can become that again." This creates a kind of therapeutic anchor that helps a person with depression not forget about their potential. Philosophers and psychologists often talk about how dogs teach us the most important skill, to live in the present. In the endless pursuit of achievements and constant anxiety about the future and painful memories of the past, we lose the ability to simply be here and now to enjoy the moment. Depression exacerbates this problem, further detaching a person from the present. Dogs, however, are masters of here and now. They don't plan, analyze, or worry. They live life to the fullest every minute. And next to them, we involuntarily learn to do the same. In conclusion, I would like to say the connection between humans and dogs is something more than just the coexistence of two species. These are deep, mutually enriching relationships that have been formed over thousands of years of joint evolution. And in the context of fighting depression, one of the most common mental disorders of our time, these relationships acquire special value and significance. From structuring the day to stimulating physical activity, from biochemical changes in the body to developing social connections, from unconditional acceptance to learning to live in the present moment, dogs help people with depression on many levels, creating a complex therapeutic effect that is difficult to achieve by any other methods. If you suffer from depression or know someone who is struggling with it, perhaps it's worth thinking about a four-legged therapist. The decision to get a dog should be thoughtful and balanced, but the potential benefits of such a step can exceed all expectations. After all, sometimes the most effective medicine for depression has four paws, a tail, and an amazing ability to love us as we are. Thank you for your attention. If you liked this video, don't forget to like and subscribe to the channel. In the comments, you can share your stories about how dogs helped you or your loved ones in difficult times. Each such story is another confirmation of that amazing connection that exists between people and dogs, a connection that helps us remain humane and find joy even in the darkest times. Until next time.